A marathon runner. No smoking. No junk food. Perfect weight. Had a heart attack at 38. And his doctor had checked him just 6 months before. Everything came back normal. So what did they miss? What does every standard checkup miss? And could it be missing something in you right now? Stay with me for the next few minutes, because what I'm about to show you is not taught in schools. It's barely talked about on the internet, and it might be the most important thing you watch this year. Here's the thing nobody tells you. Being healthy does not make you immune. It just changes when and how. In hospitals, we have a term for it. We call it the silent period. It's the window, sometimes 10, 20, even 30 years long, where serious damage is happening inside your arteries and your body is giving you zero signals, zero pain, zero warning. You feel great, you look great. And the whole time, something is quietly building. Today, I'm going to show you exactly what that is, why your body hides it so well, and this is the part that actually matters. What you can check right now that most people never think to look at. We're going to go through 5 things. By the end, you're going to understand your own heart better than most people who've never had a health scare. Let's get into it. Number 1. The damage starts way earlier than anyone thinks. Here's what your heart actually looks like from the inside. You've got this pump, powerful muscle, and wrapped around it are these pipes called coronary arteries. Their job is simple: deliver blood and oxygen to the heart muscle itself constantly without stopping. Now, imagine those pipes are brand new, smooth on the inside, wide open. Blood flows through easy. But starting as early as your 20s, sometimes even your teens, tiny things begin to irritate the inside walls of those pipes. High blood pressure pushing too hard, sugar in the blood scratching at the lining, inflammation doing its thing silently, invisibly. And what does your body do? It tries to fix it. It patches those irritated spots. It sends repair material over, and slowly, year by year, those patches build up. They harden, the pipes get narrower, and you feel absolutely nothing. Nothing. For years. That's the scary part, and that's also exactly why this is so preventable if you catch it early. Number 2. The biggest myth in heart health, and it's literally costing people their lives. Most people think a heart attack only happens when an artery gets totally, completely blocked. Like a pipe that's been stuffed shut. And yeah, that can happen. But here's what nobody tells you. The most dangerous situation is not a fully blocked artery. It's a partially narrowed one with an unstable patch on the wall. And that patch suddenly ruptures. When that happens, your blood sees it as an injury and rushes to clot it. Except now that clot is blocking the artery from the inside, and it happens fast. Not over years, in minutes. And the person who had that artery, they felt totally fine the day before. Worked out that morning, had no idea. This is why I feel fine is not a health plan. Feeling fine just means your body hasn't hit the point where it can't compensate anymore. But here's the flip side, and this is important. This is also the part where what you do every single day makes a real difference. Because those patches, that build up, the stability of those artery walls, all of that is influenced by your lifestyle over time. Which brings us to number 3. Number 3. Your body is literally hiding the problem from you, and it's doing it on purpose. This one blows people's minds. When an artery starts narrowing, your body doesn't just sit there, it adapts. It actually starts growing little side pathways, tiny backup routes, so blood can still get through. It's like your internal GPS rerouting around traffic. So a person can walk around with 60, even 70% narrowing in a major coronary artery and have zero symptoms. Zero. Because the body rerouted around it. Brilliant, right? Except it's also hiding the danger. And the thing that exposes it? Demand. The moment that person's heart suddenly needs more blood than usual, intense exercise, a stressful situation, extreme heat. The backup routes can't keep up. Supply can't match demand. That's the moment. That's when symptoms show up. That's when some people find out for the first time that something was going on all along. But here's what I need you to hear. That moment doesn't have to be a crisis. It can be a checkup. It can be a test. It can be a conversation with your doctor. That's the whole point of knowing this. Example, not a real patient. Let me give you a real-world picture of what this actually looks like. Imagine a guy, let's call him Danny, 41 years old. Coaches his kids' soccer team on weekends. Hits the gym 3 times a week. Doesn't smoke. Barely drinks. Watches what he eats. From the outside, Danny is the picture of health. One Saturday, he's running around to practice, stops to grab some water, and feels this weird pressure in his chest. Not pain exactly, more like someone leaning on him from the inside. Bit dizzy, short of breath. He sits down. It goes away in 10 minutes. He figures it was the heat. Doesn't mention it to anyone. That right there? That was his body sending a flare-up. That was supply versus met. Demand hitting its limit for the first time. And he almost missed it. Now in this fictional version of the story, Danny mentions it to his wife that night. She makes him go get checked. And what they find is significant narrowing in one of his coronary arteries. No heart attack yet, but a real clear warning sign, caught early. That's the win. Not dramatic, not a crisis, just someone who paid attention to something that felt a little off, got it looked at, and now has a plan. That's what catching it early actually looks like. Number 4. The symptoms people miss, especially women, and why the movie version is totally wrong. Pop culture has given us one image of a heart attack, a guy grabbing his chest, falling to the floor. And that's made millions of people ignore their actual warning signs because they don't match the movie. In reality, symptoms can be way quieter, way easier to explain away. For women especially, and this is critically important, heart-related warning signs often show up as deep, unusual fatigue. Not regular tired. The kind of tired that doesn't make sense for what you did that day. It can feel like nausea, like jaw pain or upper back pressure, like being short of breath climbing stairs you've climbed 100 times, like something just feels off but you can't explain it. For men, chest pressure is more common, but even that gets written off. Feels like heartburn, feels like a pulled muscle, feels like stress, and so people wait. And waiting is the one thing you really don't want to do. The rule is simple. If something feels new, different, and it keeps coming back, that's the moment to get it checked. Not tomorrow. Not next month. That week. Number 5. The 5 things worth actually checking, and most people had never even thought about number 3. Okay, this is the part the whole video has been building toward, because information without action is just anxiety. So here's what you can actually do. 1. Know your blood pressure number. Not a rough idea of it. The actual number. High blood pressure is the #1 silent damager of artery walls, and you can have it for years without feeling a thing. Check it. A pharmacy, a clinic, a home cuff. It takes 2 minutes. 2. Know your fasting blood sugar. High blood sugar scratches up those artery linings over time. It's one of those slow build things that creeps up before any diagnosis. A basic blood test from your doctor catches it early. 3. Know your CRP level. This one most people have never heard of. CRP stands for C-reactive protein. It's an inflammation marker in your blood. High CRP means your body has ongoing inflammation, including potentially inside your arteries. This is not on standard checkups unless you ask. Ask for it. 4. Know your cholesterol breakdown, specifically your LDL and HDL ratio. Not just, my cholesterol is fine. The breakdown matters. Your doctor can order this in a standard lipid panel. 5. If you're over 40, or if you have a family history of heart problems, ask about a coronary artery calcium scan. It's an imaging test that actually shows whether calcium, which is what those hardened patches are made of, has started building up in your arteries. It's one of the most useful early detection tools we have, and most people have never been told it exists. None of these require you to overhaul your life overnight. They're just numbers, information. And once you have that information, you and your doctor can actually make a real plan, instead of just hoping everything is okay. So let's be real for a second. Most people won't do any of this. They'll watch this video, think that's interesting, and go back to assuming they're fine because they feel fine. And I get it, that's human nature. Nobody wants to think about this stuff, but you're still here, which means something and you took this seriously, and that already puts you ahead. Go get your blood pressure checked this week. Ask your doctor for a full lipid panel and a CRP test at your next visit. If you're over 40 with any family history, bring up the calcium scan. These are not big asks, they're just smart ones. Your heart has been working every single minute of your entire life without you asking it to. The least we can do is pay attention to it before it asks to get loud. Share this video with someone you actually care about, not as a forward, not as a just in case, but because this is the kind of stuff that genuinely matters and barely gets talked about until it's too late. I'll see you in the next one. Stay well.